All right, my good people, welcome back. And in this class, I want us to consider questions. Kisti, this is surgery. A 25-year-old man working at a factory sustains burn injury secondary to hot water. His entire anterior tarsal and anterior aspect of the right upper arm were involved. On examination, they were blistering, blanching, and erythema, and a normal pinprick sensation. Classify the burn injury if the land and Browder chart was used. Now, for this kind of equation, the first thing is we will see we've been told about the features of this burn. We have got blistering, blanching, erythema, and normal pinprick sensation. When you are classifying burns according to the degree of injury or how deep it has gone, we classify them into first degree, second degree, third degree, and the fourth degree. The first degree burns, we as well call these ones as superficial burns because they are only on top. They only involve the epidermis specifically, which is the upper layer epidermis. When you look at the second degree bends, we call these as partial bends. So this can be classified into the superficial partial or deep partial. Now, when you look at the features of these superficial bends here, the superficial bends, number one is that they look reddish, and then there is pain. Okay, there's a lot of pain because the epithelium is not been, the nerves have not been touched. Another thing is that they show a feature which you call blanching. This is when you press on the burn, it appears white because blood supply is still there. So those are the features. When it comes to the superficial, partial, the way you differentiate from the superficial just is that these ones they show blisters with the other features as the superficial ones. For example, there's going to be pain, there's going to be redness, there's going to be blanching and such. Basically the same, right? But when it comes to the deep partial, what is going to be the distinguishing feature for the deep partial? The, another thing, when you look at the area that is involved, okay, the superficial partial is going to be the epidermis, including the upper part of the dermis, which we call the papillary dermis. But the deep partial is going to involve the entire epidermis and the entire dermis, meaning that for the dermis, we're including the papillary layer and also what we call the reticular layer. But when it comes to the features for the deep partial, the skin is going to look mottled. Okay, you are going to have these layers of dark layers and then red layers, dark and such. That is the mottled appearance. There's also going to be some, of course, blisters. Pain is going to be there, but of course, it's going to be reduced. When it comes to the third degree, we call these as full thickness burns. And what happens for this is that it goes all the way, it will cover the epidermis, the dermis, and including also the hypodermis. So there are no blisters really for this one. And there's not going to be pain because the skin has all gone. The nerve endings have been taken away. And the skin is going to look leathery and also brownish or black. And we call that as a charred appearance. Okay. Or there's going to be what we call an eschar. An eschar is basically this appearance where you've got a leathery and a brownish appearance. The fourth degree burns just means that the burn has now gone to things like the bones. It has gone way, way deep, including also the bones, muscles, and things like fat, tendons. All right. So that is what happens. Now, for this question, we've been told. So for this one, since there's blistering, blanching, and erythema, that is a reddish appearance, and then there's pain, meaning that it's going to be a partial superficial because of the blistering. Okay, so that is what happens. And then how now do you calculate the percentage? And we've been told using the land and the Browder. Okay, when you're using this land and Browder, this one you use it according to the age. of the patient that you are dealing with. It is going to be age specific. That is important to know, okay, when you're calculating these bends. So in this case, we are going to use the rule of nines to be able to approximate, because we don't have the land and Browder chart. So we're going to use the rule of nines. So here we've been told that the anterior tursor has been involved. The anterior tursor just is the anterior trunk. That includes the chest plus the abdomen. So the anterior aspect of the trunk carries 18% of the total when it is bent. And then we also have the anterior aspect of the right upper arm. Okay, so this is the arm. This is the upper limb. Hmm, okay, let me put it like that. That's the upper limb. So we have got the arm, which is there, and then we also have the forearm. So the entire right upper limb, the arm and the forearm, actually carries 9%. But since this is only talking about the arm, so this is just going to be half of 9, which is 4.5%. But again, we've been told it's just the anterior aspect of the right upper. So only the anterior aspect. Because for the arm, it's going to be both anterior and posterior. So we're going to divide what is half of this 4.5. That will be about, is it a 2.25%? So this is going to be only the front aspect, because the back is also going to be the same number, so that when you add them, you get a 4.5. So we have got 2.25 plus 18. That is going to give us about 20.25%. So this is going to be the total surface area. So this is a superficial partial bend with a 20.25% bend. So the best option here is option number A.